Hi, I'm Andrew with VATA, and today I'm going to be going over our Chester Chest models in the various variations that they do come in. So right here we are going to have our 2400, and this is our 2402. This is the main Chester models that we sell, but I will also touch on the couple other variations that come in. Today I want to go over three different things with you guys. I want to go over, the first thing is going to be kind of what is on the model when you get it. Right out of the box, what are the different parts on it, and then also kind of some of the options that you can get. The second thing I'll go over is how different people are using the model, at least from what we've heard, and how you might be able to use the model once you have it. And then the last thing I want to go over is kind of going to be the questions that we get. What parts are replaceable? How do you clean it? How do you care for it? Those types of questions that we get quite often to hopefully answer any of them that you have before you're looking to purchase. So like I said, this right here is going to be our standard model here. This is our 2400, the version we've been selling for years. Out of the box, it's going to have an arm and a body. Those are going to be separate. I'll show you how to put those together in just a second. But on the arm, you're going to have a peripheral IV site down here. On the inner bicep, you're going to have your dual PICC. On the chest here, we have our tunneled central venous catheter. And then on this side here, you're going to have your soft chest flap that's removable. And underneath that, you're going to have your implanted port. There is also the option of adding a subclavian line here or a jugular. It doesn't come with a line there, but there is the hole there. Everything's ready to go. You would just need to either have your own line or purchase one from us. And again, I can touch on a little bit of that later. Other things are going to be, there is a kit that comes with it, and that's just going to have a few other parts to help do some different simulations. First one's going to be the 420 insert. The second one is going to be the 440 insert, and we'll go over how both of these are used in just a second. And then in that kit, there is going to be a small thing of baby powder here, and we'll go over that kind of in our use and care. And then also there is an instruction manual in there. So that's going to kind of help you maybe go over some of the things that I'm talking about right now. So you have your model, it's assembled, it's ready to go. How do you actually use it? Well, on the back of the model, you're going to see the different lines. And this can be helpful for both somebody who has a brand new model as well as maybe somebody that has an old model to see kind of what you may have or what you may be missing. So on the back here, you're going to have different lines that are going to the front. So like we said here, we have our tunneled central venous catheter line right here, and this is the line from our port. Both of those lines are going to go into this clear tube set here, and that is going to go down to one single tube down on this end. That tube is what you're going to attach to our blood bag. That's how we're going to feed fluid both to the front as we want to aspirate and get a blood return to both confirm that our line is clear or that we've accessed the port correctly, as well as that's how fluid is going to come through into the model, just like we were going to do an infusion or we're going to flush the lines. So in order to get the model ready for use, what you would do is you would take the cap off of that blood bag, and then you would attach it to that clear line there. And now your tubing is going to be attached to blood. It's a closed loop system. And then you would go to the front of the model. You would take your syringe. You would attach it to the line here. You would pull back. That's going to actually pull fluid out into the model, and it's going to be ready to use, and it's going to be primed. So basically, you're going to do that first access on both the tunneled central line here as well as the port. After you do that first access, the model is now fully primed and fully ready to use. On the arm, it's going to be a very similar situation. So I can just pivot the arm up here. You're going to see in here various tubing, all feeding into the blood bag here. This one line here is going to come out, and that is going to split. And that is going to split to supply both the PICC line as well as the peripheral IV site. So both of those are going to be fed by the one line here. Again, in order to get that primed, you can just, you'll actually need to undo the pinch clamp coming right out of the blood bag. There is another pinch clamp up here. It is not pinched when we send it to you, but if it is, you just need to undo it. And then on the front, just taking the cap off of the peripheral IV site, again, pulling back, get it to have a little bit of blood come out, and doing the same thing on the PICC line. You do that on all four of those lines, and the model will be ready to use, ready to go. So now that you have your model primed, it's ready to go, how do you actually use this? What do you use this for? First thing is going to be identification of the different lines. So like I said, we have the peripheral IV, the PICC, the tunneled line, and the port. If I'm the one teaching, I can go through each one of these lines individually. I can explain to people what the line is, what does a PICC stand for, explaining all the basics of it. Why would you use this line over that line, going through the pros and cons of each line or the necessity for a line depending on the patient's backstory. How do you use the line? What medications can you put into a line? What should you not do into a different line? All the ins and outs of each one of these lines. You can go over that both in very general terms, very specific to the patients in your area of a hospital, whatever it might be, you can go over all of that with the people that you're educating. After you've gone through all that, people can go ahead and practice accessing these lines. So one of the big things we see is people going through, and it's not just the accessing of a PICC line. It is all the stuff you need to do before and after that access. So it's how do you set up all your supplies? How do you keep things sterile if you need to be doing something sterile? Do you need to confirm anything with the patient? Ask them any questions. You can ask those to, if I'm the teacher, you can ask them to me and I can reply like I'm the patient. Going through all of those different steps. After you're done, how do you put your stuff away? How do you put the caps back on the end of the PICC line? All of those different things. Go through all of that, and then they can be given feedback in real time or afterwards, kind of on the things that maybe they did great and the things that they need to improve on. After they've learned how to access all of that, the next big one is going to be dressing changes. So maybe I'm somebody who my only job is going to be going in and doing dressing changes on wounds. How do I do a dressing change on a PICC line? Going in there, and again, what do I need to do to keep things clean? Do I wear gloves? Do I not wear gloves? Do they need to be sterile? All those different things that need to be really emphasized to the person that's going to be doing this. That can be done on the model. They can show you that they know how to do all that stuff correctly, and you can give them any feedback that they need to have prior to going and doing these with actual patients. They can get all that in a more controlled environment. So that's going to be the main things for the peripheral IV site, for the PICC line and the tunneled line here. On the port, it's going to be very similar, where you're going to explain what a port is, how do you access a port, and go ahead and show that. But on this one here, obviously, there's going to be a little bit more. It's not as simple, I guess, as attaching a syringe to a needle that's already placed. You're going to have to be placing something. So with the port, I briefly showed earlier, the chest flap, it is removable. So we can pull that off. And now that we have that off, we can see some more on what's underneath here. Right now, I went over the 420 and the 440 insert. There's already the 430 insert. That's what ships with the model. That insert there is going to do a couple of things. One is if you place the port near the top of it up here, that is going to have it be very stable when you go to palpate when the skin is on top of it. So that's going to be kind of your ideal situation when you're accessing. The next thing you can do is you can actually pull out a little bit more slack of the line and tip it on its side in here. When you tip it on its side in there and the skin's on top and they're going to palpate, they're going to be looking for that septum, and when they don't find the septum, when they're not able to feel it, or they're going to feel this sharper edge of the side of the port, they hopefully should know that something's wrong. And then in that situation, it's, okay, I think the port's turned on its side, what do I do? Do I manually change it? Do I go get somebody? What is my next step? And let's go through that process so they know. With these inserts that we have, we can do two different things. One is we can just go ahead and pull out that insert, place the 420 insert in, and once that's placed in here, this is going to be kind of like a concave little bowl in here. And when it's in there, two things, you can just leave it in there and it's going to be a flat access. The other thing that you can do, which is pretty helpful for people, is to put like KY jelly or some kind of other lubricant in there. That lubricant's going to basically make it so the port's going to slide around a little bit easier. And when you go to palpate on top of the skin and you go to secure your port, if I just take 2 fingers and I go like this, the port can kind of slide out. And I'm going to need to make sure I use 3 fingers or something else to really get that port secured. So you can do that. And then with the 440, this one here can be placed on top, and then with the skin on top of that, it's just going to add an extra almost 1/4 inch of skin on top. What's nice about that is that can just simulate more of a deep placement. That can be either on a larger patient or maybe on a woman where they place the port a little bit low and it's starting to get into the breast tissue, and there's just more skin between the skin surface and where the port is. So you might need to have a longer needle when you're going to access, or it's going to be more difficult to palpate it. So once you get whatever inserts you're going to have on top of there, again, you would place your skin on top of the port, and then you can access the port either standing up or you can lay the model completely down or recline slightly like a patient might be laying in a bed. And that's going to give you the ability to access. So whether it's with the port or any of the other lines, one of the things that's really great on here, and again, whether it's accessing the line or doing a dressing change on there, is it gives you the ability to practice over and over again. Try different techniques, make some mistakes on something where there's not going to be a consequence, but you're able to try, well, what if I try putting the dressing on this way because the last time the adhesive got stuck on my fingers, or what if I do it that way or this? I mean, it just gives you the ability to practice. On the port, the same type of thing. It's how do you go in there with the Huber needle and go in at the right speed? How do I make sure that I found the septum correctly and that I've gone in? So it just gives you that ability to practice over and over again. And if somebody is there to instruct you, it gives them the ability to give you a lot of feedback when you're not doing this on an actual patient. On the model here, it does come with all of these different lines. One of the things we do get people asking occasionally is, well, that's not the line we use at our facility. Can we put in something different? Short answer, yes, you can. You can put in any line you want for the most part. The two biggest things we see is people replacing the PICC line or the port for something that's more specific to them. If you want to do that, a couple of ways you can do that. One is let us know at the time you purchase the model, and we will say, great, send us what you have. So if you have a port or a PICC that's specific to your facility you want, send it to us. When we are assembling your Chester, we will put that into the model for you and we will send it out to you. Or you can do it on your end. It is pretty straightforward as long as it's similar in size to the ones we have. And again, you can contact us to talk about that and kind of get that set up. As you're using the model, some of the things that are going to happen to the model is parts are going to go bad, parts are going to break, and parts are going to need to be replaced. So the biggest thing we see as far as replacement parts is going to be the chest flap here. This is the 405, and this one over here, this is the 404. So both of these will need to be replaced. One thing that we do see a lot is people not using the whole skin flap here. We know that the ports might be typically in one specific area, but if you do want to get a little bit more life out of your model, move the port around. Don't just have it sit in this one location. You can pull additional slack out of the line and you can have it go down here. It might not be anatomical, but it might give you just more accesses and extend the model a little bit and reduce your cost of training. So you could still put it up here to practice palpating it and then say, we know this isn't anatomically correct, but we can still access it. That way you're going to be using a larger chunk of the skin and not just what we typically see is usually a postage stamp size area that's just been stuck hundreds of times. So that's one way to really help the model get better use. The other thing is going to be all of the other lines, we do see them break, we do see them needing to be replaced. And if that does happen to you, know that anything on the model can be replaced, whether it's an individual part you need or you need a whole bunch of different parts to really get the model back up and running. All of that can be done. If you're going to do that, a couple of different ways you can do that. Easiest way is going to be to get in touch with us. Take a picture of the front of the model and the back of the model, send it to us, and say, I have a model, it's got broken parts, missing parts, can you help me figure out what I need? We can give you a list of exactly the parts you need in a few minutes. That way you're ready to go. We can give you a quote and you know exactly what you need to purchase. You can also go on our website. You'll see all the replacement parts underneath the Chester product pages, and that will hopefully help you. And then the last thing you can do is our Chester refurbishment program. Basically what that is people that have Chesters that are older, they've been used a lot, they've been neglected, whatever it might be, they just need some TLC. And so if you have that, again, contact us in the office. People will be able to give you an RGA number. When you send it back, we'll give you a quote. That quote will basically give you the price to replace everything on the model that needs to be replaced, clean the model, get everything to where the model looks brand new and back out to you. That is a great option for people, and we see people doing that quite often. To do that, all you need is the arm, the body, and the base. As long as you have that, you can send it back. And the cost is going to be right around half the cost of a new model if we have to replace everything. So it's a great option, save you some money, and you'll only be out of your model for 2 to 4 weeks, depending on how busy we are. So that's a really good option. As we start to go through the model, a couple of other things on it. I mentioned at the beginning there's variations on the Chester model. So over the years, we have changed things on the model. It stayed relatively the same, but there have been some changes. The biggest change has been on the arms. So a couple of things. If you have a really old Chester, a Chester that's probably pre-2007, that model there is gonna have a different arm than this. The PICC line is not gonna be on the inside of the arm, it's gonna be more here right at the bend. And then the arm isn't gonna be tilted out to the side, it's gonna be more straightforward. So we did make a couple of changes in that one there. If you do have that arm and wanna replace it because it's not accurate, really, these new arms will bolt directly onto any aged Chester. You don't have to have a newer Chester. This will go on a Chester that's 30 years old and it'll fit pretty well. So that's one thing you can do. The other thing is we have gone through a couple of different arms. We do sell 2 different arms right now. This is the typical arm that we do sell, but we do have a port access arm. And so I do want to go over that quickly. So the port access arm, when you see the 2 arms side by side, they are the exact same with the exception of this area up here. And this is something we definitely want people to be aware of. This is the port access area. So in this area right here, this is for you to put a peripheral or a passport in here. That is something we had customers asking us for a lot 10 to 15 years ago. Not as much anymore, but we do still sell the arm. But basically, that's what this insert is for. So if you're not gonna be using that for a peripheral port, we would definitely recommend getting this arm. And I would say that for 2 reasons that people don't always notice. The first thing is gonna be the cost. This arm is just more expensive to produce, and so we sell it. The PICC dressing. And so here you've got all this area around the PICC line site for doing your dressing changes. On this one here, this can get in the way, so part of your dressing will be down here, and then part of it will go up onto this skin, which can be inconvenient. So again, unless you're gonna be using the peripheral port in here, I would definitely recommend using this arm here. It's just gonna be a better arm for you. Other questions on the model are gonna be kind of, we went over how to replace parts, broken parts, mildew building up in the lines and whatnot. So it shouldn't happen and it won't happen quickly, but if you do happen to store your model for months on end, then definitely there's some things you can do and should do prior to storing it for that long period of time. The first thing is gonna be flush all the lines out, drain everything, flush the lines with saline or a mixture of isopropyl alcohol and water or distilled water. Flush them and leave them open so that they can air dry. That's gonna be the big one. If you are gonna be, again, storing it, take the blood bag, drain the blood bag, and again, maybe rinse it out really well and then leave the cap open, let it air dry. That's gonna prevent any of that mold from growing. If mold does grow, you can just replace the lines, but again, flushing it and letting it dry is gonna reduce your cost in the long run. The other big thing we get questions on is how do I clean the model? That's kind of across all of our different products, but on Chester and a couple of our other products, it's a big one. We get these back and there is adhesive buildup all over the arm here. There's adhesive buildup all over the chest. The model is sticky and it's kind of gross. So first thing to do is take the dressings off when you're done doing your training and clean it right then. Use soap and water and just clean off the little bit of adhesive. Don't let it get to that point of buildup. If it does get to that point, whether it's from you or somebody else, kind of the 3-step process in trying to get it clean is gonna start with, again, soap and water. That's the easiest thing. If that doesn't work, especially with adhesive, I would suggest isopropyl alcohol. That's a great thing to break down adhesive. If that doesn't work, or it's just kind of looking like it's too time consuming, use something like Goo Gone, Goof Off, any of these things that are similar in product. You can get these like at Home Depot or your local hardware store. Take this, take a clean paper towel, spray it really well, or pour out some of it on it, and then place that on top of the area that has the adhesive buildup. Let it sit for 5 minutes or longer, and after it's sat for that long, then you wanna just wipe down really hard on that adhesive. You should see all of it or most of it come off. Depending on how much of adhesive has built up in that area, you may have to do that 2 or maybe even 3 times to get all the adhesive off, but that will do a really good job of cleaning this up. After that is done, take isopropyl alcohol and wipe it down. All of these products are really oily, and so they're gonna leave an oily residue anywhere that you put them on the body. And if you leave that oily residue on there, nothing is gonna stick. It's gonna be a natural release and your dressings won't stick next time. So wipe it down with isopropyl alcohol. That's gonna keep it nice and clean. The other thing you can do on this model is, especially if it's a really old model or it's just been used a lot and cleaned a lot, the surface of the material will start to break down a little bit, and like 3M, like Tegaderm dressings or whatnot, they'll start to stick just a little bit more aggressive than you would like. If that happens, I would recommend, again, going to like a hardware store or going to an auto parts store and getting like a general use wax or like a car wax and just rubbing it into the surface, buffing it in there with a clean towel, and follow the instructions just like they would say to use it on a car. That's gonna kind of reseal the surface of this material, and it's gonna just prevent those dressings from sticking too aggressively and allow them to peel off pretty easily. On the chest flap, similar cleaning process on here, slightly different. I don't recommend the Goo Gone as much on here, you can do it, but soap and water should do a really good job on here, or alcohol. With this one here, just like with the other things we said, let it dry really, really well. You want it completely dry. After it's completely dry, comes with the baby powder, use this on it, sprinkle it all over it, and then wipe it off with a clean, dry towel, wipe off all the excess. That's gonna kind of give it a nice smooth feel. It's gonna feel nice and soft. It's gonna prevent dirt from adhering to it as easily, and it's gonna help your dressings kind of stick, but also come off really easily as well. The only other thing on this model is there is a carrying case that's optional. So if you are somebody that's going to be transporting the model around either across a larger facility, or you're going to be going from facility to facility, that case is a great option to get. All of these replacement parts, the case, some of the cleaning instructions, that is all going to be on our website. You might be finding this video on our website, but if not, we'll put some information on how to get to our website, the product page, at the end of this video. If any of the questions that you have aren't answered on there, feel free to reach out to one of us. We'll be happy to do our best to help you out, get you the answers you need, get you a quote, whatever it might be. But again, thank you for watching these. If you have any questions, let us know.